CED is publishing this video in good faith. The talk by Dr Peter Winfrey represents his general medical opinion on issues related to overseas travel. It should not be constituted as medical advice. For any queries about the content of the video, please contact CED at admin@ced.org.uk. Thank you.
So, good evening and welcome to the fifth in our series of tech talks for this season. My name is Angus Armstrong. I'm a member of the CED Executive Committee, and I organise the tech talks. All our talks are recorded and will be available on CED's website and our YouTube channel sometime after the talk. So tonight we're very pleased that Dr Peter Winfrey has agreed to talk to us this evening. He trained in St Mary's Paddington, which is now part of Imperial College of Science, Technology and Medicine, followed by post-qualification GP training. Later, he did a diploma in tropical medicine and hygiene, 2 years of surgical training, and 18 months of anaesthetics. So a well-qualified gentleman. Made him well qualified for his post as medical superintendent at Kisiizi Hospital in Uganda with the Church Missionary Society. But this is but a glimpse of Peter's career, which I'm sure would make a fascinating talk in its own right to see his travel to various parts of the globe, serving people in his with his medical skills. So tonight's talk is titled Travel and Health in Developing Countries, and it's one I've been looking forward to because it's a subject that certainly before I first travelled with CED, I was a bit anxious about going away into a developing world context. So hopefully Peter will help allay some folks' fears a little bit, and maybe those who are long in the tooth with travelling may take the opportunity to review how they go about things. Our last talk of this season will be in about a month's time on the third Thursday of April at 7 o'clock. If you would like to be added to the mailing list, then drop me an email at admin@ced.org.uk. Super. So now I'm going to share my, no, I'm going to bring Peter in, and I'm going to unpin myself. So Peter, has that come up for you?
It has. Thank you very much, Angus. Yes.
I will hand over to you and just give me the nod when you want me to move this on a page.
Okay. Well, thanks for inviting me to do the talk, and I hope that you get a lot out of it. If we could have the next slide, please. So this is what we're going to cover during this evening, and I'll start with some thanks, and then we come to the only two things you need to remember, and you can forget the rest of the talk as long as you remember those two things. So if you want to switch off after 10 minutes, that's fine, but we'll come to that in a moment. We'll talk about water and food, and when it goes wrong, diarrhea. We'll have a brief talk about minor trauma and common things which are common both to the UK and overseas. We'll briefly touch on major trauma because occasionally you will come across it and it can be a bit scary. It's a bit scary for me too, even as a trained person. We'll talk momentarily about sex and HIV. It's a good section at the end on resources, and then we'll have a time for questions. So if we could have the next slide, please. So this demonstrates that engineers have got somewhere already. This is, I don't know where this slide is taken, but looks like somewhere perhaps in Africa, and they've obviously been doing some good work there. Let's have the next slide. Engineers save more lives than doctors. Yes, you do. So thank you very much. Clean water and sewage disposal make huge differences to all-cause mortality, and it's you guys we have to thank. The contribution that doctor's mate is there, of course, and perhaps you could say it was important with things like vaccines, and I'd agree with you, but overall it's the engineers who carry the crown. And the next slide, please. So these are the only two things you have to remember, because these are the things that are going to kill you when you're overseas: road accidents and dying from malaria. You won't be killed, well, it's unlikely, by an angry mob of Muslims who don't like the way you're preaching. You're more likely to have a problem with a road accident. Let's have the next slide. So this picture was taken somewhere non-developing, and you can tell that because the roads are in good order. There aren't lots of potholes, and it's likely that where this happened, that there was good health care for the people who were unfortunate enough to be involved in the white car versus blue car. In the developing world, it's different. The health care provision is very patchy. Often the hospitals don't have the right equipment, they don't have the staff, they don't have the intravenous fluids and the oxygen that you need. And so your health experience, if you've been involved in a road accident, is much more likely to have a less good outcome because the stuff isn't there to treat you. And don't forget that the bad Samaritan may get to you before the good Samaritan comes along. And I've heard plenty of stories of people being robbed after they've suffered a road accident, and so they're busy feeling absolutely terrible with fractured X, Y, and Z. And the first person who comes along just steals whatever they can rather than helping them. So the bad Samaritan may arrive before the good one turns up. That's how it is in these places. I'm not saying it doesn't happen in the developing countries as well. Of course it does, but it's more likely to happen in the developing world. Next slide, please. This is just a reminder to take your antimalarials. You don't have to take Lariam. There are other ones out there, but you have to take something. And I always got perturbed when I was working overseas, coming across expatriates who told me they had stopped taking their antimalarials, or they weren't bothering, because as we will discover later in the talk, that's a very silly thing to do. Next picture, please. This is the kind of thing that you'll come across in the developing world. These are people who are going to the CED Christmas party, and you can see it's quite a popular event. One or two of them perhaps not wearing seatbelts in this thing here, and you wonder about the loading and everything else. But I mean, obviously I've chosen an extreme example off the internet for a bit of a laugh, but you do have highly overloaded vehicles, which obviously has an impact on road safety. Can we have the next slide, please? So yeah, road deaths are the #1 killers of expatriates. I've lost 4 friends overseas to road accidents. Local drivers often don't have a driving test. They may have bribed their way into getting a driver's license. So the quality of the driving is poor. You must always wear a seatbelt, and if there isn't one on public transport, then take something else that you can use as a seatbelt. Some of the big luggage straps are a very good stand-in for a seatbelt. It's always a good idea to hire a local driver who has done a proper test, rather than driving yourself. I made the mistake of driving myself because I thought it was too posh to have a chauffeur. What an idiot I was. I nearly drove off the road. And you do come across situations when driving where you don't particularly know what to do. I was coming back one evening by myself, driving my Land Rover, and came over a slight rise at 40 miles an hour with a 2-ton vehicle. And just in front of me is a very small child who's barely able to walk, standing right in the middle of the road. Fortunately, I was able to swerve round her and pick her up and take her off the road, and take her back to her parents who were drunk. And then anyway, when I got back to the hospital, I said, oh, what would have happened if I had run her over and killed her? And the people said, oh, the local people would have come out of the houses and would have killed you. That's what would have happened. So obviously a local driver knows these kinds of things. He knows the language, and it's a very, very good idea to hire a local person who knows how to drive, who's got experience, to drive you about. And it's not a waste of money by any sense, and it's a good idea because you're obviously supporting the local economy, and you're helping yourself as well. Ensure your own vehicle is well maintained. It's quite difficult to do, but it's money well spent. The roads are often poor, the vehicles are often poor, as we've seen. The drivers are often poor and don't follow the rules. I used to reckon that every 10th trip between Kisiizi Hospital and Kampala, I would have a near-death experience where you'd come to the brow of a hill and two buses would come over the hill, one overtaking the other, one on your side of the road and one on the correct side of the road. And you had to get off the road very quickly, which your local driver was able to do. But that happened about every 10th time I made the 8-hour journey up to Kampala. Carry a first aid kit in your vehicle and pray. We all pray before we travel, but in Africa, you really mean it. Okay, next slide, please. Has this car passed its MOT?
Mm-hmm.
And the next slide, please. So this is the female mosquito, which is the one that passes malaria around. Next slide, please. Malaria is very important. Get advice before you leave about what prophylaxis you need to take. It changes, and get up-to-date information. Drug resistance is a real thing, and what worked 5 years ago may not be appropriate now for the place that you're going to. Start your anti-malarials before you travel. Don't wait till you get to the airport on the other side where you've arrived. Start before travel so that they're in the system, and you've got good levels of the medicines whizzing around your bloodstream when you arrive. And also keep taking the tablets for 4 weeks after you leave the endemic zone, because it's still possible that the parasites can give you some bad news during that period. If you've bitten the day before you left, you can still potentially get malaria 4 weeks later. Prophylaxis is relative, it's not absolute. So if you get bitten enough and you're on tablets, you can still get malaria. It doesn't make you bulletproof, it helps, but you should always be aware that if you have a flu-like illness when you get back to the UK, that it could be malaria. And we'll come on to that in a moment. Cover up when you're going about the place, particularly at dawn and dusk. Cover up with long sleeves and trousers, and use a DEET repellent. I recently was in New Zealand, where they don't have malaria, but they do have sandflies, and there was a very good repellent there called Bushman, which had got lots of DEET in it, but there are plenty of repellents out there. Find one and use it. Always sleep under an impregnated bed net. Impregnated bed nets mean that you're effectively a baited trap, because the mosquitoes can ascend a CO2 gradient. They've got a marvelous piece of technology inside them. It means that they can tell that there's a bit more CO2 over there than there is over here, so I should go in that direction. And oh, there's Angus to bite. So they can ascend the CO2 gradient. But if you're sleeping under an impregnated bed net, you're actually a baited trap. With you're the bait, and when they hit the bed net, they die if it's impregnated. It is possible to get ill quickly with malaria, and the local help may be terrible, just like with the road accident help, it may be very poor. It is possible to have it go from having the first symptoms of malaria to dying in less than 24 hours. That's rare, but it can happen. Next slide, please. So this bed net has been made by an engineer, as you can tell. It's a good piece of engineering there. It's all nicely done. Take one, if you're going to a hotel, the hotel will have broken windows and broken screens, because they always do, even good ones. And so take your bed net with you, take some cup hooks and some string, and put up the cup hooks around the room. You can always take them down later. There are normally sort of little crevices that you can get them into. Take your string and put up your bed net. Make sure that you tuck it in, as this one is, and try to avoid touching the sides. And the next slide, please. Malaria symptoms. Generally, high fever and feeling really rubbish are common symptoms of malaria. The fever may be irregular. You don't necessarily get the fever every 2 days or every 3 days with the different types. You get sweats. It feels like flu. You often get muscle pains as well. If this is how you feel, make sure you get a smear test done. There's something called a thick film smear test. And this is particularly true in the UK, where it may be that your GP doesn't necessarily think of it. Tell him or her that you've been away. Can you have a thick film done? And these can be arranged. And all the big DGH hospitals in the UK have people who are trained how to look for malaria parasites on thick films. We have about 500 to 1,000 cases in the UK per annum. The other symptoms are anemia, big spleen, which you may or may not be able to pick up. The spleen is on just under the left side of the rib cage. Jaundice, when you go yellow. And in severe cases, you can get delirium, diarrhea and vomiting, convulsions, renal failure, coma. I mean, it can be, these are pre-death events. And certainly when I was working in Kisiizi Hospital, we had a malaria epidemic when we arrived, and we had 3,000 cases over a 3-month period and 200 deaths. Mostly those were children under 5, but it can happen to adults as well. Next slide, please. So this isn't someone who's been to the CED Christmas party. This is someone with advanced malaria. If you look closely at the eyes, you can see they're slightly yellow. I don't know whether this man survived or not, but you can see he looks unwell. He's hot, sweaty. He's got a reduced conscious level. Looks like there's probably a nasogastric tube going in there, and there's probably some oxygen going in as well. And he may need a blood transfusion and various other interventions, obviously antimalarial treatment. Let's move on now to the next topic, which is clean water. Clean water is very important. There's a lot of choice. If you go onto Amazon, there's pages and pages of different things to buy to ensure that you have clean water. And obviously, if you're in a static setting, there's something like a big Berkey filtration system, which we'll look at in a moment. But if you're going traveling, then there are other things which are more portable. But it's important to have something. And there are other ways of sterilizing water, like using chlorine tablets or boiling the water. If you buy bottled water, check that the seals are intact, because sometimes what happens in developing countries is when people throw the bottles away, the kids collect them and then they fill them up with ordinary tap water and put a stopper back in that looks like the real thing. And it's not actually fresh water at all. Beware of ice. Freezing does not kill the bugs that give you diarrhea. It just sort of slows them down for a bit, and you put it in your drink and you get diarrhea, and you can also do that in posh hotels. I managed to get diarrhea from a posh hotel in Egypt on one occasion because I didn't clean my teeth with bottled water. I thought, it's only a little bit, I'll just use the tap in the hotel. And I spent the next 3 or 4 days looking at the ceiling, feeling rotten and rushing to the toilet. So let's have the next slide. So this is a big Berkey on the left. This is £368 worth of excitement. Well worth it. You pour the unfresh water into the top container, and it filters down through these ceramic candle-like things into the lower container, and then that gives you fresh water to drink, which is why the girl on the right is looking so happy, because she's healthy and she's got clean water. And I would recommend this as something to have when you're in your house, in wherever it is. Next slide, please. So food is another good way to get diarrhea, and avoiding it is perhaps more complicated than you think. There are a few rules that you should follow. Freshly cooked food is generally all right. Street vendor food is often not, because of the flies. Unopened packet food is okay. And if you're not quite sure what to eat, then I tend to go for a few boiled eggs, because it's hard to go wrong with that. We've got some hard boiled eggs, so there won't be many bugs in there. If you buy milk locally, then you need to boil it, because it's often diluted. It's possible to get D&V despite being in a posh hotel. I don't know if you ever saw the Bond movie with the hotel in the lake in India, where he dresses up as a crocodile. Anyway, I went there on one occasion and had what I thought was a nice meal, but the food had been kept at room temperature for most of the day, and we all got ill. So even though it was one of the poshest hotels in India, it can still make you unwell. I had a person who worked for the accountancy firm in Uganda, and she was told, don't eat anything or drink anything when you go somewhere, because the people will try and knock you off. It's rare, but she was good to follow that advice. And yeah, grasshoppers are a good source of protein. You don't have to do that, of course, but I enjoyed those. Also, sago grubs, if you're in Papua New Guinea, they're a nice source of protein as well. Let's have the next slide. So here are some flies on street vendors' food. Flies tread in poo, and then they tread on your cake. Poo contains 10 to the power of 13 organisms per gram of poo. So you don't need much poo. Enough, on a fly's foot is easily enough to make you unwell. And that's one of the reasons why you avoid food like this. Next slide, please. Just a little reminder that laughter is the best medicine. And next slide. Traveller's diarrhea is common. At least 50% of people who go overseas get traveller's diarrhea. You may get tummy pain and vomiting as well. It is, fortunately, usually self-limiting, but if it is severe, and by that I mean if the pain is a lot, or you're passing blood, or you need to travel, then there are some antibiotics that you can take, which are mentioned there. And I'll come on to the resources section at the end about where you can get these from. Just for those people who are uninitiated, 7/7 means 7 days, and 5/7 is 5 days. It's just medical shorthand. You're probably familiar with Imodium, which you can get in the UK. You can buy it over the counter, and that's got the dosages there. And you can also use codeine. Codeine's helpful because it slows the gut down, but it also is a pain reliever. and often you're in pain when you have these episodes. So it's a double benefit. Fluid replacement is very important. You must replace what comes out the bottom end with a similar or more quantity of what's going in the top end. So rehydration sachets are one way of doing it, but another way, which is quite easy, is to use some Fanta or Sprite, which you could get in 2-litre bottles. And these are quite common. You can get them overseas. Just shake the fizz out and then drink the flat Fanta or the flat Sprite and use that for your rehydration, because it's got the right amount of sugar and salt in it to be just right for that. And if it's in a proper container, the original container, then it should be okay. If you've got a child, then use a cup and spoon to rehydrate them. Giving children or even adults a lot of fluid all at once is not a good plan, because they just vomit it up. And so giving small quantities, little and often, little and often, little and often, is a good idea. But if your child doesn't wee for 18 hours, then get help. Let's move on to the next one. So this lady may have a fractured collarbone or clavicle, and we're on to the minor trauma next. And a triangular bandage in this fashion is helpful, because it takes the weight of the arm off the collarbone, the clavicle, and it means that it's much more likely to heal. Let's have the next slide. So minor trauma is looked after the same way as you do in this country, except obviously you're going to have fewer resources, because you'll just have what you can take with you. If you've got a wound, it's good to clean it with soap and water and use a brush to get rid of the dirt. If you haven't got a brush, use your toothbrush, and then clean your toothbrush later with some boiling water before you use it for what you usually use it for. Antiseptic cream or iodine is a good way to get rid of the bugs, and you want to do that. And obviously putting an ordinary plaster over it is a good idea. Steri strips are quite handy for small cuts. And you don't need a nurse or a doctor to apply those. Just make sure that the edges are dry, and then the stuff tends to stick. Slight minor burns have to be cooled down, and just run that under the tap, and then apply a non-adherent dressing to it. Make sure that you're up to date with your jabs, particularly the tetanus, before leaving. I mean, if you're going to an area where there are other things, then you may well be having other jabs for things like Japanese bee encephalitis and other excitement, but you'll get advice on that before you travel by going to a travel clinic. A nosebleed. I don't wish to patronize you guys, but obviously you get nosebleeds in the UK as well. Perhaps, Angus, you could just demonstrate by pinching the bottom of your nose for us, since you're on the screen, and so that we can see how to stop a nosebleed. I'll demonstrate for me. Can you see me? Right, maybe.
You're the only person that folks can see. And
okay, right. Well, in that case, that's how it's this lower part of the nose that you grip. It's no good doing stuff up here. That doesn't make any difference at all. It's this part of the nose, and 5 minutes by the clock. The minor analgesics you can see there are the ones you can get in the UK, and you can get them overseas as well. And just take full doses if you want to get full effects. Okay, let's have the next slide, please. So this is a fungal infection. You can see from the slide that the toes look a different color, and there's a definite line where it's slightly scaly and it's a slightly darker color, and that's typical of a fungal infection. You can obviously get it in the groin as well, the various acronyms for that, which I won't say. I thought it was perhaps better to show a foot than a groin. This is treated with antifungal creams, and the treatment is for as long as it takes to disappear, and then another 10 days, because the fungus is still there when you can't see it. So you have to bash it on the head for an extra 10 days beyond when you think it's already healed. And if we could have the next one, please. Cellulitis is something which a lot of people would be familiar with. It's an infection under the skin where it goes hot and red. And normally what we say to people is draw a biro around the red bit. And then if you can tell it's getting worse, if it goes beyond the biro mark. And if that's the case, then there's some antibiotics that you can treat it with. Skin infection, fungal infections we've talked about. Heat stroke, best avoided, but treat it by cooling down lots of water. Most sore throats and earaches do not need antibiotics, but if someone has had something which is very painful or lasting a long time, then you treat as at the top there with the clarithromycin for 5 to 7 days. And again, chesty coughs and fever, which have got a fever and discolored sputum, need antibiotics, but a lot of coughs and colds don't. And obviously that's down to the judgment of people at the time. Let's have the next one. So we're moving on to the sort of more major trauma stuff now, and it depends. It's possible that you'll come across this. When someone is in an extreme situation, the airway is something that you have to be sure that is working well initially, because obviously if there's no oxygen going in, then death is going to occur in about 4 or 5 minutes. Let's go on to the next slide. So again, this is the kind of stuff which we as doctors deal with, but if you come across a roadside scene where you could potentially help people, then opening the airway is the first thing that you need to make sure that's happening. Then checking that someone is breathing, and if they're not, then doing mouth-to-mouth resuscitation. This probably isn't the place to show you how to do this kind of thing, but there are other avenues for people to explore that. And then circulation is the next thing. So ABC, airway, breathing, circulation. It's important to stop bleeding if you can. And you can stop any bleeding of limbs with pressure and elevation. And you can just use a piece of cloth, a handkerchief or a shirt, and press on it, and that will stop any bleeding. Even bleeding from an artery can be stopped with pressure. Penetrating wounds, which affect the chest or the abdomen, can't be stopped with pressure. You need a surgeon to fix that. So you have to go to a hospital and have a surgeon open someone up and do the relevant stuff. It is possible to lose a lot of blood into a pelvic fracture, and just binding someone's pelvis with your good old triangular bandage or something else that you've got to hand is a good way of reducing the amount of bleeding into the pelvis. Splinting of legs, we'll come on to, there's a slide of that coming up soon. Tourniquets. Tourniquets can be improvised out of a piece of cloth and a stick, or a wooden spoon, or a piece of cutlery or something like that. If tourniquets are applied properly, they are very painful. But you have to stop the bleeding. If you are going to apply a tourniquet, you have to warn the patient that it's really going to hurt. And also note the time that you've applied it, because you can't have them forever. And if people have got severe burns, then cool, as described before, with water and cover with cling film. Now, I suppose it's possible you don't have any cling film, but if you do, that's a useful thing to do. And if you have the next slide, please. So this is if you had one broken leg, you can just strap it to the next one. I mean, you can do it also with fingers and stuff. It's just a way of immobilizing it, which reduces pain and reduces swelling and bleeding. Let's have the next slide. So I was going to ask if anyone knew this lady and knew why she'd been in the news, but obviously we're not doing a sort of question and answer thing quite yet. But anyway, this is Ellie Harrison. Some of you may have come across her from the BBC recently. I think it was in the last month or so. She's heterosexual, she's straight, and the thing that's surprising is she's HIV positive. And I presume that she acquired the infection sexually. She's only 26 years old, and she's not kind of someone you would expect to be HIV positive, but you only need a single episode of unprotected intercourse to become HIV positive, which I suspect happened to her. And 1 in 5 people who are HIV positive don't know that they are. So, you know, there's a risk out there. Let's have the next slide. So HIV can't be acquired from a normal social interactions of handshaking and hugging and that kind of thing. You get it through bodily fluids. You can also get it through blood donations. Blood donations are normally screened for HIV, but it's always good to ask if you're in a tropical country. And do consider becoming a blood donor. When I arrived at Kisiizi Hospital, I gave a unit of blood on the first day I got there, and it was immediately used to save the lives of 2 children. They had half a unit each. They had severe malaria and they got very anemic. So you can consider becoming a blood donor. And if you're in a community, which expats often are, then you can use each other as sort of a blood bank, as long as you're prepared to give. When I worked in Papua New Guinea, we used to have Eddie the carpenter, who was group O negative, and Eddie would always give you a unit, which was very helpful because we had pregnant ladies who needed to have blood when they had bleeding in their deliveries. So HIV is, as most of you know, acquired through unsafe sex. The business of French kissing is a little bit of a red herring, but I guess if you were very vigorous, it'd be possible to pass it on that way. And if you had the other person had mouth ulcers, you can also get it if blood is splashed from someone who's HIV positive onto the eyes or mouth of someone else. And dirty needles and equipment can also pass it on. The business of giving post-exposure antiretrovirals is only really appropriate in the sort of medical setting, because you have to start them very quickly after the exposure. So we used to have some that we kept, in hospitals because when I was operating, there was always the risk that you were going to infect yourself. But praise God, I never had to use it. Okay, let's have the next slide. So the resources. Can I thoroughly recommend Nomad Travel? They give advice about traveling overseas, and they have clinics, and you could go and have vaccinations. They also do these very good medical kits, which have got the antibiotics in that I've described during this talk. And for 50 quid, you can get the ultimate medical kit. If I was going to get that kit, I'd add a few extra things to it. I'd add some chloramphenicol eye ointment. I'd add some cocodamol that you can buy over the counter. And I'd add some more antifungal cream and some more 1% hydrocortisone and some more plasters. But that's a very minor complaint. I think it's a really good kit. I've seen what's in it, and it's £50 well spent. There's a book that I can recommend. This thing here, this book called Traveller's Health: How to Stay Healthy Abroad. On the front it says, it is as indispensable to travel as a toothbrush, signed Michael Palin. It weighs 0.7 of a kilo. It's about 500 pages, and it's got a lot of really good stuff in it. It's small, and you don't have to read all of it. I wouldn't expect you to. And there's bits of it that are technical, but there's some really good bits on malaria prevention, food and water, and stuff like that. So only £11. So it's I thoroughly recommend that. There's another book called Your Child Abroad, a travel health guide, which is slightly out of date now. 2004 was when it was last updated, but it's a really good book. If you're a parent, it's scary being a parent sometimes anyway, even in the UK. And this book gets very good reviews from parents from remote places. We took a copy of it when we were overseas because we had little kids, and it was very helpful. So I recommend that. Okay, so we've now got time for questions, and so I'll take questions if you have any.
So with a bit of luck, we've got
Peter, I bought a medical kit when I first went to Tanzania, but that's quite a long time ago now. Happily, I've never had to unseal the packet, but it says it's way out of date. What's in it that's going to be affected by being there for so long, or will most of it still be useful?
Most of it will still be useful.
Okay, thank you.
Yeah, I mean, the business about sort of use by dates on medication is really the manufacturers sort of covering themselves. Most medication is completely fine, even when it's years and years and years out of date. And I'm always taking out of date medication myself, and so far it hasn't done me any harm. I suppose there's a risk that out of date medication won't be as potent as the stuff that is in date, and so it's possible that if you took antibiotics that they wouldn't fully cure an infection. That would be the risk. But things like, bandages and stuff, well, they're not going to go out of date for 40, 50 years, are they, until they fall to bits. So I suspect that nearly everything in your medical kit will be fine.
Okay, thank you.
Peter, I'll keep the questions going. You talked about Germaline for cuts.
Yes.
I've heard it said that with a cut, the best thing is just to get it really clean and put absolutely nothing on it. But are you saying that actually a lotion is a good thing to put on to stop infection, particularly in a hot country?
Yeah, I mean, I would. And iodine's good too. The thing is that you won't necessarily get it really clean. That's the problem. It can be hard if you've got sort of overhanging edges or the wound is quite deep. It can be hard to get absolutely everything out. So yeah, if I get one myself, and I did recently, I cleaned it really hard, and then I stuck some Germaline on it.
Right, thank you.
if I could ask you on that same theme, you were talking about cleaning the wound out with water, and I wondered if the same sort of rules applied in terms of drinking water. Could I just use any old water?
Well, certainly initially you can use any old water, because even if the water is contaminated, it won't be as contaminated as the wound. So it's a dilution effect that you're going for. When I worked in Uganda, we used to do osteomyelitis operations. That's where there's an infection in the bone, and the attending orderly would get a hose pipe and attach it to the ordinary tap, and we would irrigate the wound, the osteomyelitis wound, with tap water. And you could say, well, that's awful. And in a sense it is, but we knew that it's mostly to dilution, and using a gallon of tap water is actually better than using a pint of pure water, because it's getting rid of nearly all the bugs. And you could put your special super clean water on at the end, if you had some, but it's mostly a dilutional effect, which is key.
Thank you.
Could I ask about the mosquito nets, please? The treated ones.
Sure.
How long do they last in terms of the treatment that they've been given?
Well, the gold standard advice is they should be redone about every 1 year. I think they should be re-dipped, and they probably last for 2 or 3. But I think the gold standard advice is that you should retreat them with permethrin on an annual basis. Now, if you're having the thing strung up in your mud hut for 365 days, then obviously it's going to get a lot more use and a lot more evaporation and stuff than if it's in your cupboard at home in Scotland in a plastic bag, and you only get it out for 2 weeks. So it depends partly on how much exposure this bed net is getting to the elements, but that's my understanding. And you can use it for clothing as well. Certainly the night watchman at the hospital and stuff, we tried to encourage them to have permethrin soaked clothing, because that is again a way of reducing the risk of malaria transmission.
Thank you.
And Peter, other places where you can just buy these things? If you're in London, is there somewhere that they?
Yes, yeah, there are. Yeah, there are. Yeah.
Thank you.
I mean, the internet's a marvelous thing, isn't it? I mean, you can get almost anything off Mr. Amazon these days, and it will come within a few days, won't it?
The reason I'm asking is because we're flying out to Sierra Leone in about a week, and so your talk was the most timely talk I've ever come across. So yeah.
If you start, I don't know what you need for Sierra Leone, but do you need antimalarials?
Yeah, we got those. And
you've started taking them?
No, because I've got Malarone, is it?
Right. You need to start that a couple of days before, don't you?
Oh, yeah.
Yeah. So, and don't forget to keep taking them for a month after you get back.
I think it's only a week actually with Malarone, which is another advantage of it.
Okay. Yeah. I mean, there are different ones out there, but it's important to take them. Yeah.
Peter, I got caught with a kind of vomiting diarrhea when I was in Uganda, having eaten something, I think, in a restaurant. But I came across the times where you just can't get food that you feel you can eat. There's, maybe you go to an unknown town and there's just nothing on the menu you feel comfortable to eat. So the next time I went out, I took food actually in a suitcase, just dry breads, flatbreads, all those, crackers or whatever, just so that you had a substitute in case you couldn't get anything. Do you think that's a good idea?
Yeah. If your luggage allowance allows, then having some stuff like that. I mean, it is possible to buy those kind of things in packets in country. You don't necessarily have to have a suitcase full of them, but I think that's good to have a backup.
One of the things we were recommended, one of the things we were recommended was that it's safe to eat food that you have to unpeel, such as bananas or oranges, as long as obviously when you're touching them, your hands are clean. So I always recommend to people to buy a good load of bananas that they're traveling, because it has nutrients and it's generally safe to eat those.
Yes, Ian, I agree with you. And in the Traveller's Health book, the guy recommends having a small pocket knife so you can peel your oranges and whatever. There we go. He's obviously a retired Boy Scout. So no, good advice. I would concur with that.
And I also found that if you had stomach problems, eat yogurt, get hold of some yogurt, because that seems to quell the problem. And I had a problem when I went to Uganda. I don't know if it was the last time, but the only thing I ate for about 24 hours was yogurt, and that helped to clear it up.
Yeah, it kind of depends where the yogurts come from, doesn't it? I mean, the other thing is, it is possible to not eat anything. Okay, there was that nutcase who, Mr. David Blaine, who put himself in a perspex box over the Thames for a month a few years ago. So you don't have to eat anything. You'll be thinner at the end, as I'm sure he was, but you do have to drink, and you have to get the fluid in. So if you don't eat for a few days or even a week, it's not the end of the world, but you do have to get the fluid in. That's really crucial. So if there isn't anything to eat, don't panic.
Yeah, we used to reckon at least 24 hours to abstain from food. We were hit several times when we were in Pakistan. 24 hours at least, and then, as you say, keep drinking and sipping clean water or suitable drinks. Helped us overcome it.
Yeah.
I had a query as you're going through that on crockery and cutlery. You were talking about spooning fluids into a child. Goodness knows where the crockery and cutlery's been washed.
Oh, sure. But I mean, if in that situation, you would use some boiling water to sterilize things.
Okay.
And that would be a very easy way of just pouring some boiling water over the relevant utensils. And
so if you go to a restaurant, say, and you get nice fresh cooked food served up on a plate with a knife and fork.
Well, it's never going to be 100% bulletproof, is it?
No.
And even if you go to posh places, it's not 100% guaranteed. Local advice, from expats who are living in wherever it is, about where they go and where they get on well is worth its weight. So take local advice. I mean, I guess if you were completely obsessional about it, you could take some wipes with you and wipe the cutlery before you use it. And I certainly heard of people doing that on aircraft, or sort of wiping around the seat and all that kind of thing. It depends on how obsessional you are and how much you're willing to give it a go.
Mm-hmm. I think it's the night before you fly home that you're most itchy about. Well, I've got a whole list of questions here, but I think I'm going to drop you an email afterwards.
Well, that's all right. I mean, it may be that someone else would be interested in the question.
I'll jump to a brief one on malaria. If I come home potentially with malarial bugs running around me, could I give that to someone at home?
Well, if you've got a good going Anopheles mosquito population where you live, which I think in Aviemore is unlikely, then I think no is the answer. There is not much person-to-person transmission.
Right. That's the answer. Yep, that's the answer. Thank you. Yeah,
you don't have to go in quarantine, Angus.
Yep. You said take your own seatbelt. That was a novel idea. Having travelled in a car that's had one effective seatbelt, and there were three of us.
If you're in a car that has an accident, say you're a rear seat passenger, when the car stops, if it's doing, I don't know, 40 miles an hour or something, the amount of force that you generate when you hit the guy in front is something like an elephant charging at him. It's force is mass times acceleration, as I'm sure you know. So not only do you risk injuring yourself, but you're risk injuring someone else. If you're thrown out of the vehicle, your risk of dying increases 5-fold.
Yeah. And so I'm fine. It's a good idea. I was uncomfortable travelling in this vehicle without a seatbelt. But what am I going to? How would I improvise a seatbelt in a car?
You can get these very thick straps that go round suitcases. But they're made of webbing, and they have to be about sort of 3 inches wide. And you could use one of those. You could wrap it around the back of the seat and then round your stomach, as long as you haven't had too many curries. You weren't too porky.
And the fact that you're only holding your stomach and your top half goes slamming down.
It's better than nothing.
It's better than nothing. That's the answer. Yep. Okay. And I'm hogging the show here, so shout anybody if you want to jump in. And my last priority question was treating water with chemicals. And so we've got chlorine, we've got iodine, and we've got chlorine diox. And are they all equal, or would you?
I don't know the answer to that. I haven't seen sort of a qualitative study that ranks them in order. I think that certainly for the chlorine tablets are probably more easily accessible. And if you're using iodine, I think you have to be quite careful to get the dose right. And with all of these things, there has to be a certain amount of standing time. Once you put the iodine or the chlorine tablets into the water bottle, you have to let it stand for, a number of minutes for it to work. You can't just glug it straight down, because it's got to actually act on the protozoa or whatever it is that you're trying to kill.
I think one of the things with if you're trying to put chlorine tablets into dirty, turbid water, is that the turbidity would have quite a chlorine demand, which
Indeed.
would mean that you wouldn't achieve disinfection until you've got enough chlorine added. So you're better to put it into as clear water as you can, really.
And you can filter it through your shirt.
I would add at this point, Peter, that Nigel did an excellent talk for us last year on his Clariwash filtration system, self backwashing filtration system. It's magnificent. And so, hot potato for Nigel.
Yeah, thank you.
Yeah. Well, there are lots of those water purification systems available, and it's just a question of finding one that suits your budget and how much you're willing to carry around with you.
Peter, can I ask you a question about antibiotics? Because that's like the untouchable with GPs these days. So if you go to a GP and say you're just off to a developing country and you'd like some antibiotics to take with you, are you going to get shown the door, or is that a reasonable request to make to your local GP?
It depends on your GP. If you came to see me, you'd get a fair hearing.
Right.
But then I'm biased because I've been there.
Yes. If you went to a nomad travel clinic, could you have the same conversation and just pick some up?
Yes, I mean you would need to. They interview you, so they give a phone interview before they let you buy this ultimate medical kit.
Yes.
And then just to make sure that the antibiotics are appropriate in case you're taking something else.
Sure. Okay.
I mean, there are some interactions, like if you're on a statin, then it's best to temporarily stop that if you're going to take clarithromycin, for example. Right. So there are occasional drug interactions which mean that they can't just hand it out to everybody.
You know your audience, don't you? We're probably all on statins.
Well, I am as well.
Yeah, right.
But yes, it depends on your GP. If you've got a good relationship with your GP and you don't ask for too much, then you'll probably get away with it. But I mean, good luck getting an appointment. That's the first thing.
Yeah.
Would they not charge you for them, Peter?
It depends. Again, they might do. I mean, you could sweeten the pill by saying, look, could you just give me a private script for these and I'll pay for them, because they're not that expensive. And they might agree to that as a sort of halfway house.
Thank you.
One of the prophylactics you can take is doxycycline.
It is.
So would that be adequate as an antibiotic? Because you're taking it to reduce, getting malaria, but does it? It would also help, would it not, in some of those things you were talking about?
It would. Yes, it would. Yeah.
Which anti-malaria would be best to have to cover a lot of things then, apart from the malaria?
Well, doxycycline, yes, is the only one really, because that's and most of the antimalarials are not antibiotics.
I think we took doxycycline last time.
I mean, one of the difficulties with doxycycline is it can cause photosensitivity, and often these malaria parasites are found in countries where the sun is bright. So there are risks with that.
Yes, that's why I take Malaran.
Where you beat your pith hat and keep covered up.
Indeed, yeah.
And high factor sun cream.
Yeah, very important, because if you get a good amount of sunburn, that alters the sort of DNA in the skin and means you're more likely to get certain kinds of cancer. And you only need one good burn to have a permanently increased risk.
Mm.
Mm-hmm.
I don't think we want to hear too much more from you, Peter.
Yeah, we were having a conversation before we started. I mean, Peter walks around with all this stuff in his head, and he's got more to worry about than the rest of us put together. I think we've probably run our course, and I think I'm speaking for everybody. I've really enjoyed it, and really that's given us more pointers. I think Barbara and Rob couldn't be better time for them. And really, really appreciate you making the time and speaking to us, Peter. And it's been an excellent talk. And hopefully people will find this on the web and find it useful going forward as well. So I think I just say thank you very much.
Yeah, thank you.
Thank you.
Thank you.
Thank you.
Very good.
Thank you, Peter.
For joining us tonight.
Well, thank you. It's nice to be asked.
Mhm.